Hello everyone, myself Dr. Dinshu Bansal, a pediatrician in Dr. Ghaziabad. On behalf of Academy of Pediatric Group Ghaziabad, today I am going to discuss an important topic, that is Down syndrome. As we all know, 21st March is the World Down Syndrome Day. From 2012 onward, every year we celebrate Down Syndrome Day to raise awareness about the Down syndrome. So what is Down syndrome? Down syndrome is a genetic condition in which the kids with Down syndrome, they are having an extra chromosome on the chromosome number 21. That's why this condition is also known as trisomy 21. So each and every child with Down syndrome is having some mild to moderate mental retardation, and the characteristic features of the Down syndrome, they can vary among different Down syndrome kids. So the common physical signs which are found in the Down syndrome kids are like decreased muscle tone at birth, excessive skin at the nape of the neck, flat nose, small eyes, upward slanting eyes, small ears, small mouth, and there can be a single palmar crease in the hand instead of two palmar crease with short hand and fingers. And in the foot, the gap between the first and second toe is very much there, and white spots on the colored part of the eye is found in these kids, which is called as brush field spots. These kids are more prone for pneumonia and infectious diseases. They are more prone for having congenital heart defects, circulatory diseases, seizure disorders, and some malignancies. So if we support them in the form of sensory stimulation, cognitive therapy, occupational therapy, physical education, they can have a better adaptive function and they can have a proper employment also, so that they can live a long life and with the employment also. Lot of federations are there in India and worldwide, like Down Syndrome Federation of India, which are supporting these kids. So what is the risk factor for the Down syndrome babies? We don't know. But advanced maternal age is an important risk factor for the development of Down syndrome. So, but each and every pregnancy should be screened for the Down syndrome, as it can occur with any pregnancy. So, Down syndrome should be screened. So, we should screen every pregnancy to look for the Down syndrome. So whenever a child with the Down syndrome is born, the parents are very upset. They various thoughts they come in their mind, that whether my kid can go to the normal school, and whether my kid is can have the pregnancy, they can marry or not. So all these we will discuss today. According to the research, majority of children with Down syndrome, they make the best progress when they are educated in the mainstream schools alongside their peers. So definitely they can go to the normal school with some support staff for these children. If the first child is having the Down syndrome, in the next pregnancy, there is very less risk to have a Down syndrome. If parents are carrier of 14 to 21 translocation, then 2 to 15% chances are there to have a Down syndrome kids in the next pregnancy. But if the parents are carrier of 21 translocation, then there is 100% chance to have a second baby with the Down syndrome. If a Down syndrome is become pregnant, then there is 50% chances of having, and but in the male Down syndrome kids, they usually are sterile. So inclusion of Down syndrome is very important, and we should fight this discrimination and stigma about this condition, and we should show empathy and awareness about this condition in our society. Thank you so much. This is signing off, Dr. Rinshu, and if you like this video, then kindly share,
like and subscribe this video.
You can comment also us on the comment section. Thank you so much.